Erica came to Land of Lakes from Helen Keller International, a leading vision, health, and nutrition non-governmental organization. As Helen Keller International Country Director in Bangladesh, Erica led a 100-person staff and $3.4 million annual budget and was responsible for all programs and operations and grew the HKI portfolio through private sector and university partnerships focused on nutrition-sensitive agriculture for field crops and research. Previously, Erica managed disaster recovery, nutrition, and food security programs that Save the Children as one component of a senior management role which included resource mobilization and strategic planning. Erica has a master's in public policy and management from the School of Oriental and African Studies in London, and a Bachelor of Arts from Macalester College, History and Sociology in St. Paul, Minnesota. Thank you for joining us.
Thank you, Bridget, and thanks to Nasima for laying the groundwork to talk about some of the issues around gender and nutrition in Bangladesh. So as Bridget said, I now work for Land O'Lakes International Development, but I'll be speaking mainly to my 7 or 8 years of experience in Bangladesh with Helen Keller International. And what I would like to talk about are some of the linkages between women empowerment and nutrition. I'll start by laying out some of the statistics and groundwork around the relationship between those two issues, talk a little about where the gaps are in programming, and then share with you one approach that HKI, Helen Keller International, has developed to look at women's empowerment and nutrition challenges. And I'd like to start by acknowledging that Bangladesh has made significant advances in terms of gender equality as well as nutrition. So women's enrollment in school, or girls' enrollment in school, has increased significantly to the point where in high school there's actually better representation of girls than boys. We have seen improvements in nutrition along with reduction in child mortality and maternal mortality, and those trends are certainly closely related. We also see now millions of women and older girls who are employed in formal paid work, particularly in the garment sector. Now that work is not without its challenges and not without the risk of exploitation, but it has created new opportunities for many, many women who would not have been able to work outside the home before. However, as Nasima mentioned, changing ideas and traditions and norms around gender is a slow process. One thing that I would like to mention is that it's very easy to blame men for some of the challenges that we face in women's disempowerment. But really, the socio-cultural norms around gender are something that men and women both hold. So for example, in HKI's work around how food is distributed or divided within the household, we found that it's actually women who are preparing and plating the food. And because men and women don't eat together, men are actually not aware that women are consuming much smaller portions of food, particularly the more nutritious food like meat and eggs and vegetables. So it's women, as well as men, who are holding back some of the progress in terms of nutrition and empowerment. And certainly the mother-in-law plays a key role in the household in terms of some of the traditions which hold women back. So Helen Keller International has a project called Food Security and Nutrition Surveillance, and we survey many thousands of families each year. We talk to women, we weigh and measure women and children to get an idea about the nutritional status in the country as a whole, as well as in the specific geographic regions. And we have now added questions around the Women's Empowerment in Agriculture Index, which is something USAID has developed to look at how women's engagement in agriculture and influence on decisions about food and agriculture contribute to changes in nutrition. So just to give you a snapshot, although there have been improvements in recent years, almost half of child mortality in Bangladesh has nutrition as one of the underlying factors. And in our research, we have found that while we've been seeing improvements in children's growth overall, so children are taller and heavier than they were before, we still see very slow progress among the youngest children. So we start weighing and measuring children from birth. And from birth up to age 6 months, we've seen much less improvement than we have in the other age groups. So that tells us that a lot of the continued malnutrition among children is actually happening in the gestational period. So children don't grow as much as they should during the pregnancy, and then later on they're more likely to remain stunted or undernourished. Not to throw too many statistics at you, but just a snapshot that very, very high levels of malnutrition continue. So almost half of children are stunted, which means they're not achieving their full height, and their brains are also not developing as much as they have the potential to do. And 16% of children are actually wasted, which is quite severe malnutrition, where you see much higher risk of mortality. And what are some of the underlying factors around this as related to nutrition? So women's dietary diversity is a big one. As I mentioned earlier, food is not distributed equitably within the household, and as a result, women are not consuming the vitamins and minerals that they need. For various reasons, including early marriage and women's own poor nutrition, babies are not born with their full growth potential. And also, adolescent marriage continues to be a very big issue around nutrition and child health. So among women who are now in their 20s, so age 20 to 30, 64% were married before the age of 18. So these adolescent mothers have a much higher risk of bearing children who are low birth weights. And research by Johns Hopkins University has found that among women who become pregnant during adolescence, their linear growth does not, it basically stops their linear growth. So if they become pregnant, they don't continue to get that growth from, say, age 13 to 16 or 18 that they would otherwise see. And this means that not only will their first pregnancy during adolescence have a likelihood of complications and a low birth weight baby, their subsequent pregnancies will also have that effect because their growth was stopped and they're more likely to be stunted. And this obviously is a cycle that continues, so the women who have children who don't realize their growth potential, those children are more likely to face poverty and other challenges, and early marriage again is likely in the subsequent generations. Domestic violence also remains a major challenge for women in Bangladesh, and early marriage is a contributing factor here as well, because the very young brides in the household have less power and less resources. So a majority of people, both men and women, still believe that beating your wife or domestic violence is still acceptable at times. This is a problem for women themselves, of course, but it also leads to maternal depression, which makes it much harder for the women to care for their children, to feed the children actively, and also to have influence over decisions in the household that would support the child's health and nutrition. We also see that when women in the household are able to influence decisions, the children in that household have much better nutrition. So Sylhet Division, which is sort of in the northeast of Bangladesh, has the worst nutrition indicators and the worst gender indicators in terms of domestic violence, women's education, and women's decision making. And Sylhet Division is actually not the poorest area. It has a lot of income because of remittances, but despite that, we believe because of the poor gender indicators there, the child nutrition has not seen the improvements that we've seen elsewhere. And in our surveillance, we have found that when women are earning income, their children are realizing better nutritional status. And this is not because there's more money in the household, because in Bangladesh, when women are going out to work, it's often because the family needs the money. And they're working as maybe domestic workers or in the garment factories. But despite that, the nutrition of the children is better because the women are more empowered. And we've actually seen that the best off households in terms of nutrition are the ones where the woman is alone with the children and the husband is working elsewhere. So they're benefiting from his income, but the woman is able to make decisions. Not to say that we would promote that as a nutritional intervention, but it is indicative of how the power relations in the household impact child health. And just to mention briefly, we don't know exactly what this means yet because it's a new trend, but overweight is increasing quite significantly in Bangladesh. And in 2012, we found that nationally, not just in the rural areas, there's more women who are overweight than underweight. And in many households, we find overweight women and malnourished children. So this is probably looking at some of the issues around women's mobility, able to go out, get exercise, that kind of thing. And this is something that's going to really increase as a challenge in coming years, and those involved in development should certainly have on their radar. Just to talk a little about the gaps in interventions, HKI did a national mapping of all the nutrition programs in Bangladesh, and I apologize for this busy slide with all the acronyms, but this here is adolescent nutrition. So you can see that of all of these sectors around nutrition, adolescent nutrition is receiving very little attention. This, by contrast, is maternal nutrition, which is great that we're intervening in that area, but that means we're not catching adolescent girls with nutrition interventions until they become pregnant, and that is very late. We have also, sort of as a global community, realize that the potential of agriculture to realize improvements in nutrition requires that women participate and are empowered to influence decisions. So that means what you would want to see is areas where there are gender, women's interventions, as well as agricultural interventions. But what HKI has seen in its mapping of program interventions is that there's very little overlap. So this is maternal nutrition programs. The darkest shaded areas are the areas of the most intervention. And then this is agriculture interventions. So you can see there's really not the kind of overlap that you would want to see to achieve impact. I'm low on time, so I'm going to talk very briefly about intervention that HKI developed called Nurturing Connections. So this draws on an approach called Stepping Stone. Some of you may have heard of that. It was developed in Uganda to look at HIV/AIDS issues. Obviously a sensitive topic, just as nutrition is in Bangladesh, because it's about the relationship in the household. And the Stepping Stones approach is to work separately with men and women to talk about some of those sensitive issues and then bring them together in community meetings. So HKI adapted this approach, but includes mothers-in-law as well. So the mothers-in-law meet, the husbands meet, and the wives meet. They talk about what some of the issues are, and then they come together to make joint decisions through hopefully sort of fun kind of exercises and activities. This is one example. So I mentioned earlier that the husbands may not actually be aware that the women are eating a different diet than they are within the same household. So this has each group show how the plates would be divided up. And it's really an eye-opening kind of exercise as people see, okay, what's actually going on around how we share our food. And we have seen good preliminary results. So this is women who report receiving assistance in household activities. And that increased in all areas except one, which is gardening. And that makes sense because the other interventions in the program engage women more in homestead food production or gardening. So that's what you would expect to see. And this is not a nutrition education program, so it uses examples around nutrition, but it assumes that the participants are getting other nutrition education. For example, the one Nasima talked about around the 1,000 Days approach. So it's not teaching them about breastfeeding and things like that, but it builds on that so they can use the information they gain in nutrition education to actually make decisions. And just to conclude that women's lack of empowerment remains a key barrier for improved nutrition in Bangladesh. And while we've made much progress, there are still gaps in the programming to address nutrition and empowerment. And that we have developed the gender transformative approach, Nurturing Connections, that we believe can be adapted for many different contexts, geographic, and even in terms of types of programming. So certainly happy to share that resource with others. And just to echo Nasima's comment that transforming habits really takes time. So we've made a lot of progress since Beijing, but we need to keep up the fight because it's really a long game. And I will leave it there. Thank you very much.